Hi, this is the online prep for wound drains and alternative dressing labs for Nursing 125. The prep, per usual, consists of Mosby's Skills videos. There's 2, changing a dressing and using wound drainage devices. The readings are in your handout. They consist of in the Skin Integrity and Wound Healing chapter. And I have also added a wound care tutorial from the F.A. Davis website for your fundamental nursing book, and I've added the website here so you can just click it and go. There are, if you haven't been in there yet, there's a lot of free resources, and this wound care tutorial is pretty darn good. I really like it, so take a peek at it. Please review your type of wounds before you come to lab. These are words that you need to understand, and different types of wounds that we have, whether they're abrasions, incisions, penetrating tunnels, ulcers. They're all very different. We need to use these words for descriptions. Please review your healing process. You need to understand the healing process in order to understand wound healing. And you need to be able to say, okay, when you look at a wound, is this healing or not? And you really, if you don't know that process behind it, you really can't make that assessment. So just please review that. And old news, but just want to go over the difference between sterile and clean. Surgical ascessus is lack of microorganisms. Unfortunately, the skin is not sterile. That is not going to be sterile, and we can't make it sterile. But we can make it clean and use clean technique when we're doing dressings. Most of the dressings that you're going to see in your career are going to be clean dressings. We now know that sterile is used mainly in operating rooms and that sort of thing. It doesn't mean that we are not going to use the clean as possible technique when we're caring for these dressings. And we will be going over this in the lab. So you'll see the major difference of what we've done in the sterile lab and what we're going to be doing in the other lab. There are some basic principles that you're going to continue to use and that you've already learned, and we will apply them here in the lab when we do the dressings. Reminder that wound care does require physician's order. Many times the nurse is the one that helps the physician develop those orders or change those orders depending on what we see when we change the dressings. You need to, and at the same time I wanted to throw in here, protect your patient and protect yourself. So when you do your dressings, you don't want the patient to get microorganisms from a hospital, the hospital-acquired infection, but you also want to protect yourself and keep yourself healthy. So there's 2 ways that we're looking at caring for these dressings. I know it's all about the nursing process, and in this case it really truly is. And if you look at the assessment plan through the evaluation, you can see how that, when you typically lay that on a wound and skin integrity issue, it really makes perfect sense. Assessment, you need to look at the whole patient, not just that specific area or the whole. What are the patient's concerns? Are they going to be, do they think they're going to lose their toe, their foot, their leg? Is there going to be a scar? So there's all kinds of things that you need to consider for the patient. Is it painful? Is the wound old, new, years old, hours old, traumatic? This all makes a difference when you're caring for them. What are the patient's comorbidities? I bet you folks right now could think of reasons why wounds don't heal and certain comorbidities that affect that, such as, the one that pops in my head is diabetes, obesity. Going on to the next one, how about patients that have poor nutritional status? Those people can be obese or very thin. We do need to look at labs and look at albumins and that sort of thing. The wound nurse that came and spoke to you folks last week talked about high protein diets. If we do have wounds that need healing and people need help, it's not just the dressing, it's not just our technique, it's what they put in their body too. So we need to be cognizant of that. And then as far as medications, are they on any medications that could actually interfere? When you look up your medications, you're always looking at how they work. What are the untoward side effects? Are there anything that interferes with circulation? That sort of thing. So please take a peek at that and be cognizant of that also when you're looking at the entire patient. Please know your terminology. I've put words on a page here, but these are wounds. These are wounds. Woo! These are words that I really want you to understand and use when you are describing a wound. You make a very vivid picture when you use these words, whether it's necrotic, fistula, infection, purulent, serous sanguinis, that sort of thing, granulation. It really makes a difference. These words are very, very descriptive, and it can make a difference for the next person coming in, what that wound looks like. Now, this wound here is a challenge, and I realize that this may shock some of you, but I wanted to show you what a true diabetic ulcer looks like. That's what this one is. And when I said look at the whole patient, not just the whole, that's absolutely true here. We may look at this and say, wow, what is going on here? But you also, again, if this is a diabetic patient, what's their glucoses? What have they been eating? Have they had ill-fitting shoes, etc.? As far as the wound is concerned, I know that the wound nurse talked about probing the wounds. This is an example of that, because if you look at the wound, we have pink skin around, and if you didn't have those Q-tips there, you wouldn't have a clue of what was going on. And this is a perfect example of tunneling. And now that we know that we will care for this wound differently. So this is a pretty striking example. I hope you don't run across these too much because they're not the best, but just want you to be aware of what it is, the extent of what it can be when you care for a wound. Also, drains. This is a schematic of a surgical patient that has a drain. It looks like it probably is in their chest or neck area. And the drain is full of what kind of drainage? Hopefully you said sanguinis, because that is pretty much pure sanguinis drainage. It's probably a fresh dressing. That's a Jackson Pratt drain there that actually has a good suction on it. And when I say that, see how this is collapsed? As a nurse, I'm going to come in here and I'm going to do my assessment. My assessment states that this does look intact. There's no other drainage here. The tube is full of drainage, sanguinis. There doesn't look like there's clots in here, and there's a good suction on there. So I know that this is working well. So you need to, there's different types of drains out there. You need to understand them, understand what you're looking for, and it really makes a difference on their patient's healing that you understand how to care for them too. And you will learn that as you go along. You are the eyes and the ears for the surgeon, and you will see this in acute care. You will see this in rehab settings where they may come to you with staples. This to me looks probably like a hip surgery. It doesn't look like a new surgery. I can tell that we have the staples in there, even though it doesn't look super straight. That doesn't look, this looks like a halfway decent one to me. I do see some pitting edema here, and you can see where they may be lying on a dressing or something like that. Not uncommon for big surgeries like hips. You can see that there has been some pooling of blood, and it's come to the surface, and that's bruising, and that isn't abnormal either. I can tell because there is some darkish old drainage here, nothing new, and there's a little bit of crusting. But other than that, there's nothing in this wound that really tells me that we have problems yet. So we need to know what we see and know how to accurately describe it, because we are the eyes and the ears for the surgeon and any other physician when you need to make changes and that sort of thing. We are the reporting folks. Accurate documentation to evaluate. This is a chronic wound, probably again another diabetic wound, but you take a look and this looks like it's been fairly old. This darkened skinned around it is probably, this is probably granulation here. And it looks like, I can't really tell, but it looks like this one's progressing. But it's going to be your documentation, your measurements, the depth, the type of drainage, and that sort of thing that's going to tell me if I'm coming on next after you. Are we going the right direction with this wound dressing, or are we regressing? So you can see as you go along, as you learn more, it begins to make a lot of sense to you, and it's critical what we do actually. Yeah, very critical. So develop your wound skills. You're not going to do this overnight. You're going to do it over a period of years. Know your dressing dressings, know your types of dressings, how they're supposed to look, and know your resources. We met a wonderful wound nurse the other day. There'll always be someone that you can talk to, run your thoughts by, and know the basic premises of wounds. And I think that will take you a long way in understanding and actually caring for them. The skills lab that we're going to have, we're going to start with wound assessment. You're going to have different types of wounds to assess. We will actually develop documentation, so know your words, your descriptions, the types of drainage and that sort of thing. Please know that when you come to lab. We will have types of dressings that you can get your hands on and take a peek at, and then they will end up in the simulation lab where you'll actually have a chance to change different types of dressings, whether it's packing, moist, etc. We'll have you do it. So that's the end of this preparation. If you have any questions, per usual, you certainly can email me or call me, and I look forward to see you on lab. Thank you.